Today I have with me Barb Schlittenhard and Collier Case with Sprint. They are in positions of leadership and training and development and human resources at Sprint. And they have some focus on this issue of mental health and the stress and anxiety that comes along with COVID-19 and the impact that it's had on their people. So first of all, thank you both for joining me today. I appreciate you taking the time.
Thank you. You bet. Thank you.
We'll just jump right in. Tell us how life has changed for you since COVID-19 came along, and we'll back up a little bit here in a minute and recognize that you all have some focus on this issue prior to COVID-19. But as far as the impact that that's had on the organization, Barb, maybe you can start and just tell me a little bit about what the world looks like at Sprint today.
Yeah, well, I think, as we reflect back, we would say almost every facet of our lives, our day-to-day working activities has changed with COVID-19. Everything from keeping our buildings safe, secure, clean, to ensuring business continuity measures are in place, and the things that we did to do that, both in our corporate offices as well as our field locations, retail stores, call centers, etc. Everything has changed in terms of how we pay employees, and as well as the resources that we provide them to assist them from, going into a call center or a retail store or a corporate office, and now working from home and doing those same activities from home. That has dramatically really just changed the world that we live in. Almost it felt like overnight.
Yeah.
There was definitely quite a quick, I would say, Sprint took actions even before stay-at-home orders in a lot of cities and states across the United States, and did some things to kind of to preempt that. But then we kicked it into high gear and really worked hard to ensure the safety, security, and really well-being of our employees. I would say health and well-being has been a top topic for employees, employers, HR organizations, but it has even more risen to the top over the last several weeks.
Yeah, I think we all have that moment when we realize that life was going to be very different, and some of us have different moments. But I've heard a lot of people, and me personally, when the NBA walked off the court in the middle of the game, that because the next day something happened, or something, I had an event planned that canceled the day after that, and so that moment of the NBA walking off the court for me was like, oh, okay, this is not anything we've seen before. About
not just going to be a week.
Yeah, right. Collier, how about you? How about any of the changes that you've seen?
Well, I think what I've seen mostly is first, a great desire for people to interact differently and to engage. Since we got isolated and working from home, I think there's this whole sense of common experience. We're all dealing with something that's very unique, and we all have different reactions to it. Personally, some of the things that I've done is I've opened up to my team to, say, hey, this is how I'm feeling, and letting people know it's safe to talk about.
Right.
They're feeling anxious, concerned. What are they doing in their own personal life? I found and encouraged my people to approach work a little bit differently, so that they have balance. I think one of the biggest impacts that it was a realization to me, I'm an empty nester at this point, but thinking about people who have families, young families at home, who are having to do now both education, working with another spouse potentially in the home. You've got multiple levels of schooling needs that need to go on, and you've got a job to do. And you have to try to find some grace. So I think managers have been encouraged to be more flexible in terms of how people go about their work. Some people I know are doing their schoolwork, in the evening with their family, and during the day they're letting their kids do their thing. And so we're letting people kind of sign in and sign out throughout the day,
Right.
which I think is really, really helpful for people dealing with a change in situations, helping them cope with a lot of different strains in their personal and family life.
Yeah, there has to be a certain degree of flexibility, right, with all of the
Mhm.
one, the constraints, and two, the demands on their time.
Yeah,
Yeah.
yeah,
Absolutely.
Yeah,
yeah.
I know
So
some
you
companies
know,
are calling it 12 to 8 out of 8 and 12, right? So you get 8 hours of work done in 12 hours of time, right? So,
Okay.
to be more flexible to your staff, or you block your calendar and tell your team, you know what, from this time to this time, my young child has a Zoom meeting with their school and typically needs my support, so
Yep.
I'm not going to be able to be available to present during those times,
Right.
but the rest of the day I've got flexibility. And that communication is important, just to understand the world that everybody's living in. I think compassion and empathy and leadership are, we're kind of changing what
Yeah.
that means
Yep.
in this time.
Mhm.
Absolutely.
I think another thing that we've tried to do also is to make sure that people are aware of the different resources that they can reach. So we're using our EAP. We've re-promoted it virtually in every communication that we have about COVID response. And letting people know those resources are there. We haven't seen a significant uptick in EAP,
Hmm.
but I think that we've definitely seen a significant change in the use of virtual telehealth and telebehavioral health services within the medical plan.
I see.
So, and that was one of our early decisions also, was to really make sure that people were aware of those resources. So we're seeing hundreds of people now using telehealth to support their medical needs in this time of change.
I see. And as you know, that EAP offering alone, that's one of those things that just has to be communicated over and over and over again,
Mhm.
because it's
Yeah,
just,
yeah,
it's forgotten so quickly, and it just kind of drifts away, and you have to stay on top of the communication of that, because people are creatures of just forgetting, those things from the past and only thinking about
yeah.
what's right in front of them. So help me understand a little bit about just how you've reacted as an organization, and specific to this area of mental health awareness, and the stress and anxiety that comes with it. What are you doing to help your people manage through that, aside from just a standard kind of EAP? Or what calls are you putting together? How are you helping people connect? Just some of those ideas.
Yeah, because people's access is so dramatically different, it really has. We haven't really dedicated corporate type of presentations around mental health. I think what we've done is we've encouraged our we've done more toward our HR leadership to help them be aware of the tools and resources that we have available to employees, reaching out for, if they want to do something with an EAP trainer to help, address particular situations. And we've had, unfortunately, a couple situations where we've had employees very adversely impacted by the disease.
Mhm.
And so we've reached out in those work sites to specifically work with the EAP and counselors to go into those work sites, talk to the employees, and help them deal with some of the impacts that have impacted that work group. So it's really more team based rather than enterprise level.
Yeah. I'm seeing a movement there, and just this recognition. We talked about stigma a little bit. You're seeing this movement for leaders to be more empowered to interact with their team on that level, right? And to be more available to their team on that level. And to your point about the enterprise level and the program offerings and all of those things, there's almost more of an encouragement. Nebraska Furniture Mart had a conversation with me the other day, and they have something called hashtag I will listen, which basically empowers their managers to speak to their teammates and encourage them that they have someone to speak to about this. And I have my own
Mhm.
personal experience with a friend of mine that went to a leader, and kind of shared the challenges that he was having, and that helped him get help. Do you feel like you're seeing that movement and that kind of thing happening within your teams, Barb? Is that something you see with your teams?
Yeah, I would say we are seeing leaders independently sharing their personal stories. And I think you mentioned it a little bit early on in terms of, sharing your own personal story can do a lot to enable your employees to, reciprocate that
Yeah.
and feel a level of trust and comfort in having those conversations. We talked about articles that we've read. Sometimes that can be a safe way for a leader to bring up their feelings. And there was a grief article that I had read, and it was like, that's it. I'm feeling this immense grief for individuals that are suffering for, myself, or, and
Right.
it's being able to connect to what you're feeling, start a conversation and dialogue. So we are seeing leaders do that. We've also added, from a learning standpoint, we have an event called Day of Learning, and we've also sent out top 10 critical skills to learn right now.
Yeah.
And a lot of them are around managing stress and collaborating and connecting, or resilience, or really just being okay to talk about how our brain works,
Right.
and how we all have fears and we all have anxiety and things that overcome us, and give them tools and ways that they can relate and adjust in the moment, because giving them a lot of different outlets and a lot of different resources will also help. EAP is amazing, and and then every time we have one of those events, we reinforce the EAP resources as well.
Right.
But
Right.
just making it more okay
Yeah.
to have open dialogue, I think is one good way to start.
Yeah, that you just hit on something by saying okay. That's something that I heard someone say in these conversations, is that it's okay to not be okay. And I think that when you point that out to someone and say it's okay to not be okay, it's okay to not be. One of the scenarios that was provided to me was that it was actually a devotion that I was reading in the morning, was talking about how when he grew up, their parents said, if one of us is unhappy, the rest of us are going to figure out how to make that person happy. And he's like, that was not a very healthy way to grow up. Like, it wasn't okay to not be happy all the time. Right. And I think that's this, it's okay to not be okay thing. The idea behind that is you're going to have struggles and challenges with this new environment, and that's okay. And we can talk about that and figure out how to get you back to a better place. I love providing that environment for your teams and your people, that it's okay to, let's have that conversation and figure out how we remedy this and how to help you repair and heal and all of that. So,
and for us, what I've seen is permission. There's a lot of permission being granted by leaders to their people to take a walk, to check off, to sign off for a little bit. I think that we are probably working more now than we were when we were in person. There's just sort of this always on. After dinner, you come back on and you're working emails, and we're in a unique situation too, because we've just completed a merger, and there was a lot of pent up meeting that we couldn't have because of antitrust issues. And as soon as the merger closed, we just got inundated with demands for our time and meetings, and dealing with West Coast time zone, as well as East Coast Central. So I mean, we're now just having just these extended days, and so the permission to, I'm going to sign off for an hour here, and I'm going to go make lunch and sit and read, or go take a walk outside, is something that I think has been most helpful for most of us.
I think you're absolutely right. That demand on all day long thing is one that is always hanging there. And I've had conversations with others about if you have a laptop, turning it all the way off, or if you have a desktop computer, turn it all the way off, because it takes some effort at 7 p.m. to fire that thing back up. Maybe that'll just
And if it's not on, you may not, you might
right,
just say, you know what, I'm
right.
just not going to wait 5 minutes for that to happen. Yeah.
You nailed it right on the head. It's going to take 5 minutes to fire it up. Maybe I'll just wait and do that in the morning.
Yeah.
And so
Yeah.
little tricks like that are things that people are coming up with to be able to kind of, keep that. These are people that walk, most people that work in the office walk away at whatever the number is, 4 o'clock, 6 o'clock, whatever, mostly, and then they're done for the day. And then all of a sudden that temptation is there. And, most of us are driven to want to get that work done. And so it's hard to turn that off. So literally turning it off is a way to do it.
Yeah, I'm do personal confession here. A week ago, I really had Groundhog Day syndrome.
Okay.
Right?
Yeah.
Every day was the same. You get up, you get your cup of coffee, and you log in your
Yep.
little space. And whether it's in your basement or your bedroom or your kitchen, wherever your little office space is.
Right.
And it was taxing. It was taxing, and there needed some venting.
Yeah.
And frustration with technology. We've all faced the I can't get the Zoom to work.
Yep.
WebEx won't load. I've lost my audio and
New jokes are coming out daily.
Yeah.
Yeah, but Ken, also I would say Sprint has done a really good job, not just with transparency of leadership, centralization of the COVID-19 side with FAQs and all the resources that Collier's been talking about, but also one of the things that impacts us all with our mental health is employability and pay. And I would say the company has really made some great decisions about in keeping employees paid during the times when stores would be closed, or
right.
moving up bonus payouts, or extending PTO carry forwards, paid time off carry forwards. All of those things impact your mental health, because
Absolutely.
it gives you financial stability. And I would just add that that's something that the organization has done as well. A couple of creative things also in retail, they created an HR assistant bot on their retail site to help answer questions, because retail had a unique situation with stores being closed, questions about their pay or their PTO, or how to handle medical situations or things in the store that were unique to the situation. I thought that was really innovative and something that the HR organization responded to quickly.
Yeah, that's great.
And we've done some things on administration side, from a benefit perspective. We've extended deadlines for, just like we've got our tax deadline extended. We've extended when you can claim your FSA funds. We've done some things within the 401k in response to some of the loosening up of regulations in 401k. And it's not something we're encouraging. We obviously think that holding your funds for future financial security is important.
Right.
But your spouse has lost work, you're moved to unemployment rates and reimbursements differ state to state. There are certain situations where you may have to tap into financial funds. So we've done a lot with at least allowing those types of resources to become available to employees, as well as promoting other financial planning tools and counseling through the EAP that are available to the employee as well. Because financial strain is definitely a critical issue right now.
Absolutely. Absolutely. And it plays into the mental health wellness of all of your people as well. It's a very good point. Well, thank you both so much for taking some time today. You've provided some insight into what your organization is dealing with as such a large organization, as well as some of the things that others can look to on areas to focus on and how to help their people. So I certainly appreciate you taking the time, and I hope you all stay well.
Thank you, Ken.
Thank you so much.
Thank you.
Appreciate it.
You bet.
Bye-bye.
Bye.